At Hertility, our main mission is to uncover the real reasons why somebody may be suffering from infertility or struggling to conceive. There are 11 different forms of female infertility as listed on the National Institute website, whether it's structural, whether it's chromosomal and genetic, whether it's ovulatory, whether it is whether it's anatomical, it's fallopian tube blockages. There are many different reasons, but one of the most overlooked reasons for people struggling to conceive is that they forget that the two determinants, the most important determinants of fertility, are a healthy egg and a healthy sperm. So for us, it's really important that we firstly educate about getting the right in the right frame of fertility, and that starts with food, and that's often, it's most the simple things that are often overlooked. So I really hope you enjoy this evening's webinar about fertility and nutrition. Thank you, Emily.
Thanks, Helen. So this is just a little bit about what we're going to be covering. So as Helen mentioned, we're talking about fertility and how it starts with nutrition. So we're going to be discussing how to prioritize your preconception health, what is a fertility diet, how nutrition can support egg health, sperm health, implantation, and then, as I said, about how a nutrition consultation can help you. And hopefully you'll come away from this feeling more informed about what you can put into your diet to optimize fertility chances and what to be mindful about. So why is good nutrition in the preconception period important? Having adequate nutrition means that we have a better chance of becoming pregnant, having a safe and healthy pregnancy, and giving birth to a healthy baby. We know that diet and lifestyle impact the critical first 1,000 days of life and can impact the health of the future child's long-term health. So when we talk about the first 1,000 days, what we're talking about is the 270 days of pregnancy and the 700 days of the first 2 years of the child's life, plus the preconception period. So depending on how long you decide to optimize your health, but we'll go a bit more into that in a second. So it's kind of this idea of epigenetics. So factors such as smoking, high alcohol intake, caffeine over 200 milligrams, poor diet and obesity may have an impact on genetic, cellular and metabolic and physiological changes during the baby's development. And this can have lasting consequences for the child into adulthood. So I think often when we think of nutrition for fertility, we focus on actually nutrition helping us to get pregnant, but it has a massive impact on the health of the child as well. And we know that maternal deficiencies in key nutrients have been linked to restricted fetal growth, preeclampsia, neural tube defects such as spinal bifida and skeletal deformities, as well as low birth weight. So it really is important, and it can increase their risk of having a low immune systems, putting them at risk of infections, neurological diseases, cardiovascular disease, and metabolic health risk.
And I guess it makes sense when we think about that preconception phase, where we're preparing our bodies to carry, to grow, and to nurture, that if we don't confer that ability to, or that we're not thoroughly nurturing, that confers a disadvantage onto the fetus, whether it's a lack of adequate vitamins or minerals, but also just the ability to, like you say, when we are in utero and forming, so many of the key processes of our development are happening. Our immune system is being laid down, our own germ cells are being determined. So it's interesting when we think not just of our baby's health and their lifetime of health, but also their fertility is also mapped out when we are pregnant.
So there are some factors that affect fertility that unfortunately diet cannot fix. However, there are some conditions that fortunately nutrition can play a role in. So conditions such as PCOS and diabetes, we can help to manage these by keeping our blood sugar within quite a tight range. And once we've got our blood sugars under control, this can also help to help ovulation and periods regulate. So what is infertility then? So infertility is defined as a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months of regular unprotected sexual intercourse. And it's sort of categorized into either primary or secondary. So primary being that you've never conceived before, and secondary being that you've had a child or previous children, and then you're having difficulty conceiving for this child.
And I think it's worth noting here on the primary and secondary infertility that with primary infertility, where you've never achieved a conception or a pregnancy, there's often a lot of emphasis around that. And actually secondary infertility as well, as a result, becomes overlooked because somebody already has a child. And the reality is that as we get older, the chances of secondary infertility given that the average age of first child is now crept up and up and up, it actually means that the cases of secondary infertility are much higher now. 1 in 3 individuals exit their fertile years with fewer children than planned. In other words, 1 in 3 individuals who had planned to have 2, 3, 4, 6, I'm one of 6, will actually have fewer, whether even if it was 2, they will end up having fewer children than they originally intended to do.
Yeah, and I do think it's the case with nutrition as well, whereby if people have had children before, then they think that they're okay. And they're like, well, whatever I did last time worked. So, I don't need to follow all of these principles this time. But actually, if you can get it right the first time, and then if you do go on to have a second child, at least it's ingrained in you then what you need to do. And it eventually, once you start implementing all of these things that we're going to talk about today, it kind of becomes second nature. And actually, it's not just about eating like this lifestyle, this way of eating is not just about fertility, because it actually just helps your overall health. For conception to happen, we need a healthy egg, we need healthy sperm, successful ovulation, successful fertilization, so for the sperm to fertilize the healthy egg and the healthy sperm, and then successful implantation.
There's a lot of steps to be had prior to actually conceiving and then actually delivering. So it's important that we take note of each of the steps along the way.
Yeah, for sure. So when should we start then? So eggs that end up being ovulated actually have been growing for about 90 days. And similarly, it takes around 72 days or 2.5 months for sperm to develop. And since the egg and sperm provide all of the genetic material, and both of those processes require nutrition for them to happen. This is why we say that it's really important in the 3 months prior to conception to really optimize your nutrition. And the aim with both the egg and sperm is basically to protect them and make a healthy environment for them to be able to mature and then to develop. Moving on to the fertility diet then. So there aren't actually any specific fertility guidelines. So the fertility diet is loosely based on, well, it's not loosely, it is based on the Mediterranean style diet. So, and the reason for that is just because it's one of the healthiest diets in the world. It's got some of the best evidence in terms of dietary patterns for supporting fertility for males and females. The Mediterranean style diet originates from a study which comes from 2007, which is the Nurses' Health Study. And there was quite a lot of takeaways from the studies, but there's just 5 here. So as an example, one of them was to include good quality, low GI carbohydrates, which we know to be beneficial in PCOS as well. So this is things like whole grains, so quinoa, brown rice, brown bread, brown pasta, full fat milk, which I imagine is probably down to the nutrients in the milk. So things like iodine.
The most nutrient dense foods there is. So even though everyone seems to be swapping over to milk alternatives, actually milk alternatives are not healthy. And full fat milk is actually incredibly nutrient dense. Also
healthy fats. There's loads of evidence for female and male fertility in terms of healthy fats. So monounsaturated fats. So this is things like olive oil, rapeseed oil, avocados, nuts, seeds. And then the other 2 on there were multivitamin use and intake of plant-based proteins. So probably the multivitamin use is because folic acid it was probably a prenatal that contains folic acid, and then also intake of plant-based proteins, which like lentils and beans, we know to be really beneficial for health. So that's what that one. So really great findings. And
I think that's incredible. 70% increase in your ovulatory function, essentially. Not increase in ovulatory function, but a reduction in those who have ovulatory infertility. So that has a significant impact for those individuals with PCOS as well.
Yeah, it's amazing.
It's unbelievable.
A fetus with ovaries has around 6 million eggs before it's even born. Then once the baby's born, they have around 1 and 2 million eggs or oocytes left. And then as we age, unfortunately, our fertility starts to decline. And also we increase our risk of chromosomal abnormalities, particularly once we hit our 30s, and particularly once we hit 35 as well. So generally people in their 20s tend to have more normal eggs, and people in their 30s have more abnormal eggs. And poor egg quality is the most common cause of miscarriage. And it can take longer to get pregnant naturally and can affect assisted reproductive technology. So how do we test our eggs? Well, number one, we can test AMH, our anti-Müllerian hormone, and we can do that via a fertility test. And you can also test your antral follicle count as well, which is where you can go and have an ultrasound, which you can also do through fertility.
I think one of the biggest questions that people ask is, how do you tell whether my eggs are of any quality? And there is, as of yet, no test that will tell you the quality of eggs. There is unfortunately statistics that give us indications for the quality of eggs and the decline in egg quality as we get older. How do we make our eggs more healthy?
Exactly. So
in this 3-month period, while these eggs are all cultivating in our ovaries, what can we do to help their chances?
Well, actually, there's quite a lot we can do, which is promising. So there are a few problems, first of all. So there's oxidative stress, which occurs when there's basically an excess of free radicals in the body. So we do produce free radicals in the body anyway, like with everything we do, even with eating. But when there's too many free radicals, then essentially it can cause oxidative stress, which causes cell damage and death. And that can happen to our reproductive cells. And there's also inflammation that can be caused from environmental toxins. So some of the causes are, as we discussed, so aging unfortunately causes oxidative stress. We can't really do anything about our age, unfortunately, but we can do something about the other causes. So alcohol, the advice there is to completely avoid alcohol, as you would do during pregnancy. Same again with smoking. And actually, I didn't mention on the last slide, but there aren't too many associations with what you can eat to affect your egg count, so your AMH. However, we do know that there is some research that shows a low AMH, a low AMH may be associated with low vitamin D, and also that smoking can affect AMH. And then also pollution as well, and AGEs, which are advanced glycation end products, which I'm going to get to in just a second. And the solution is nutritional support, and also obviously avoiding some of those causes like smoking, alcohol, drugs, etc.
Okay, let's talk about the swimmers.
Yeah, on to the swimmers. So sperm health is of as equal importance as egg health. When we're looking at for healthy sperm, we're looking at the quantity, motility, and the morphology. So morphology is the shape, and the motility is like how well it can swim. Because we also
need to know the progressive motility. So sperm can move, but they might just be twitching, or they might be swimming in circles. You want it to be swimming in a direction. It's got to have a motivation. It's got to have progressive motility, as it's called.
Just before ovulation, there's a surge in luteinizing hormone, which leads to the rupture of the egg from the growing follicle, and then it's released into the fallopian tube, which you can just see behind this image. Then it leaves behind an empty follicle, which is called the corpus luteum, and the corpus luteum produces the hormone progesterone. And the hormone progesterone plays such an important role now throughout pregnancy, but definitely in the early stages, because it prepares the uterus for pregnancy in the event that the egg is fertilized. And if it is fertilized, it will steadily increase throughout pregnancy. If it's not fertilized, then you'll essentially have a period, the corpus luteum will break down and progesterone levels will fall. If it is fertilized, then the progesterone will stimulate the growth of blood vessels to supply nutrients to the uterus, which is just fascinating. And then it will thicken the lining of the uterus, which is the endometrium, and making it a really healthy environment for the blastocyst, which is the fertilized egg, to implant and then hopefully then blossom into a pregnancy. So the aim is that we just want to reduce inflammation in that area, thicken the lining, and just make a really good environment for the embryo to grow. Vitamin B6 and vitamin C are able to increase progesterone levels, and there are a number of other nutrients as well. Again, you'll recognize some of the antioxidants that can help to play a role in improving the endometrium. So some of them thicken the lining, some of them reduce inflammation. Beetroot, for example, contains nitric oxide. It's a vasodilator, which means it increases blood flow to the endometrium, which is exactly what we want. And that's something that exercise can help with as well, get the blood flow to the reproductive organs. Other factors and considerations now. So I haven't mentioned this so far, but if you haven't listened to anything else in this webinar, then this is probably the most important thing, is that to make sure in the preconception period that you are supplementing with folic acid and vitamin D. So 400 micrograms every day up until 12 weeks of pregnancy for folic acid. Certain people are at risk of neural tube defects. So some people who have a BMI of 30 or over have diabetes. There's lots of different parameters. So have a look, see if you fall into that. People that have had a previous family history of neural tube defects. Vitamin D advice is 10 grams a day, 10 micrograms a day. And that's from right up from preconception all the way until breastfeeding. And it's really important throughout pregnancy and basically for building babies' teeth and bones, and also maintaining your own bone mineral density. And that's important throughout pregnancy and breastfeeding again, because our bone mineral density at those times decreases. And also in terms of fertility, it's associated with greater frequency of positive pregnancy tests, clinical pregnancies, and live births for people undergoing reproductive technology. And for vegans, hopefully, if you're a strict vegan, then hopefully you're supplementing anyway, but B12, iodine, omega-3s are really important, and potentially even selenium as well. Iron, iodine, folate, and choline. So obviously we just spoke about folic acid. So as I said, folate is the food form of folic acid. So it's still really important to get some of this into your diet as well. And like I said, you can get it from things like leafy greens. Also avocado has quite a bit of folate in it. Iron as well, really important in helping to reduce infertility risk in females. Iodine helps to make our thyroid hormone. It's involved in metabolism, growth. So as I mentioned, that's important for vegans to make sure they're getting enough of, but definitely for all of us anyway. And then choline, we don't have any specific recommendations for choline intake in the UK, but it is really important in terms of fertility. So for things like reducing risk of neural tube defects, so you can get it in things like chicken, eggs, fish, milk. Foods to avoid or things to avoid, there are some things that we should be avoiding. So pretty much the advice is what you should be avoiding in pregnancy, you should be avoiding in the preconception period. So smoking, fish high in mercury like swordfish, alcohol, avoiding completely if you can, limiting endocrine disruptors like Helen was talking about. So things like non-BPA, plastics, keeping caffeine under 200 milligrams a day. So a cup of tea is about 75 milligrams. and avoiding liver and liver products, which are high in vitamin A, certain medications, and then raw meat, cheese, and fish. And then this is your preconception health checklist, which obviously diet is one of the main ones that we spoke about, but also it's really important just to check in on your oral health, due to when you're pregnant, the fluctuation in hormones may mean that that your gums like swell a little, so it's good to check in on your teeth, make sure that your vaccinations, your screenings, like your smear and your STI checks are up to date. Check in on your hormones with Hertility. Come and see us for a test. We also have multiple pathways if you take a test with us, and whether you have undesirable results, or even if you have results within range, or you just wanted to speak to someone, then we've got multiple different platforms that you can seek help through us. So whether you want to see one of our private gynecologists, we do also have a fertility advisor, or we have nutrition consultations, we have scanning. There's lots of different pathways. So I mean, yeah, it's definitely good to check in on your hormones just to see where you're at, because there's multiple different causes of fluctuations in your hormones that can have a knock-on effect to your fertility.
It also might give you insights into whether or not something needs extra work. So we've got all of these additional insights that we know that actually our diet affects our hormones, and our hormones then therefore affect the way we eat, our metabolism, the way we can break down food. So it's really important to kind of understand how the two play a role hand in hand. Please do check in on your hormones. They make an awful lot of difference to your health. Emily, you have been exceptional in educating. Once again, every time I talk to you, I learn something new and feel like I need to be better in my health, but also in helping break down the kind of understanding of why. It's always so much easier when you understand why something is making a difference and where, as opposed to just being told to do something.